Assalamualaikum warahmatullahi wabarakatuh. Today I want to presentation my PowerPoint about COVID-19 pandemic. Before that, let me introduce myself. My name is Aldora Zahra Ryanto. I'm from the Faculty of Teacher Training and Education, majoring in elementary school teacher education at Muhammadiyah University of Surakarta. Welcome to this occasion. I hope you are as ready as I am to start presentation and have fun. First of all, what is corona? Coronavirus or severe acute respiratory syndrome, coronavirus 2 or SARS-CoV-2 is a virus that attacks the respiratory system. This disease due to viral infection is called COVID-19. The coronavirus can cause minor disorders of the respiratory system, severe lung infection, and death. This virus can attach anyone, such as the elderly, adults, children, and babies, including pregnant women and nursing mothers. This virus can also cause severe respiratory infections, such as lung infection or pneumonia. This virus is transmitted through sputum droplets from the respiratory tract. For example, when in a crowded closed room with poor air circulation or direct contact with droplets. The origin of corona. The initial case of COVID-19 was found last year in the Wuhan area, China. Some of these wild animals called have contracted SARS-CoV-2 from bats in the area. Scientists think the coronavirus circulation in bats and jumped to humans, possibly via an intermediate species. Then it was detached if there was one male around 55 years old of age who had a high fever for several weeks and then determined if the man had COVID-19. And this man became the first person in Wuhan to be affected by the coronavirus. Jokowi said, the origin of the coronavirus in Indonesia, as soon as there was information that a Japanese person went to Indonesia, then lived in Malaysia and was checked, there was positive for corona. The term from Indonesia immediately searched it. Japanese people to Indonesia visit who met whom they traced and met. It turns out that the person affected by the coronavirus is related to two persons, mother 64 years old and daughter 31 years old. Symptoms of COVID-19. First, the most common symptoms, fever and dry cough. 2. Slight common symptoms, discomfort and pain, sore throat, diarrhea, conjunctivitis, red eye, headache, loss or taste or smells, and then rest on the skin or discoloration of the finger or toes. And then serious symptoms, difficulty breathing or shortness of breath, chest pain and pressure in the chest, and loss of ability to speak or move. The average symptoms will appear 5 until 6 days after a person is first infected with this virus, but it could also be 14 days after being infected. COVID-19 transmission. A person can catch COVID-19 in various ways, namely, first, accidentally inhaling the droplets that come out when a person with COVID-19 coughs or sneezes. 2. Hold the mouth or nose without washing hands first after touching an object that has been spatialized with the salvia of a person with COVID-19. 3. Close contact with people with COVID-19. Next, prevention of the coronavirus or COVID-19. First, apply physical distancing, which is to maintain a minimum distance of 1 meter from the other people. And second, use a mask when of the move in public place and or crowded. And third, regularly wash your hands with soap and waters or hand sanitizer that contain at least 60% alcohol, especially after doing activities outside the home or in public place. Let's watch this video.
Hello everyone. Today we are gonna learn about how to wash your hands properly. Kali ini kita akan belajar tentang bagaimana cara mencuci tangan yang benar. Bagaimana caranya? Let's check it out. Okay, everyone, that's all for our lesson today. Don't forget to wash your hands properly and see you in the next class. Bye-bye.
Next, do not touch your eyes, mouth, and nose before washing your hands, and then insert and encourage with a healthy lifestyle such as eating nutritious foods, exercising regularly, getting adult rest, and preventing stress, and drinking vitamins and honey to maintain body immunity. And then cover mouth and nose with a tissue when coughing or sneezing, and then throw the tissue in the trash. Let's keep clean objects that are often touched and the cleanliness of the environment, including cleanliness of the house. Next, diagnosis of coronavirus or COVID-19. One, rapid test to detect antibodies produced by the body to fight the coronavirus, and two, swab test or PCR or polymerase chain reaction test to detect the coronavirus in sputum, and then CT scan or chest X-ray to detect fluid in the lungs, and then coronavirus treatment or COVID-19. One, referring people with severe COVID-19 to undergo treatment and quarantine at a referral hospital, and then provide fever and pain relievers that are safe and in accordance with the patient condition, and then encourage severe of COVID-19 to carry out independent isolation and get adequate rest, and then encourage offers of COVID-19 to drink lots of water to maintain body fluid levels. 5. Currently, doctors are starting to use healing methods using blood plasma therapy. Blood plasma is a plasma antibody taking therapy for those who have recovered from COVID-19 and given to patients. However, this method of treatment is not benefit to serious COVID-19 patients. And then the method recently carried out of by Indonesia government is vaccine. Giving the COVID-19 vaccine is the solution that is considered the next to reduce the number of cases of SARS-CoV-2 virus infections that cause COVID-19 disease. Currently, in Indonesia, many have reserved vaccine starts from health works. Thank you for taking the time to watch my video presentation. So many presentation from me this time, more or less I apologize. Wassalamualaikum warahmatullahi wabarakatuh. Bye-bye.